Thank you, Madam Deputy Speaker. There are many issues that my constituents are experiencing when trying to access GP services, but I want to focus my remarks today on the crisis affecting dentistry across England and the impact it's having on the people in Durham. And I want to start by paying tribute to the dentists, dental nurses and every other key worker in practices in County Durham and across the country. Sadly, despite the brilliant work of dental workers, NHS dentistry is on the brink of collapse. Whether it's Boburn, Brandon or Pitty my constituents are struggling to access the dental services they need or deserve. 4 in 5 people who contact Healthwatch have said they found it tough to access timely dental care, while tooth decay, as we've already heard, is currently the most common reason for hospital admissions among young children. And in County Durham, 245 children under the age of 10 were admitted to hospital for tooth extraction between 2020 and 2021. Thousands of children are currently in pain, distracted as they learn, in pain as they eat and struggling to sleep because they can't access vital treatment. Just let that sink in. And why is it so difficult to access NHS dental appointments? Because dentists are being driven away from the NHS dental services en masse. A recent poll of dentists in England found that 45% had reduced their NHS commitment since the start of the pandemic, while 75% were likely to reduce their NHS commitment in the next 12 months. Alongside this, an alarming 87% of dentists have said they've experienced symptoms of stress, burnout or other mental health problems in the past year. And in total, 3,000 dentists have moved away from NHS work completely since the start of the pandemic. And the British Dental Association has said, this is how NHS dentistry will die. This warning isn't sensationalist. It's the reality of dentists and their patients and what they're facing in Durham today. And this crisis is entirely avoidable. And it's certainly not the fault of our rail workers striking today, as the Secretary of State would like us to believe. Utterly disgraceful. And what planet is the Secretary of State on when he talks about record funding? That certainly isn't the case in NHS dentistry. NHS dentistry have faced cuts unparalleled to the rest of NHS services. In real terms, the government's net spend on general dental practice in England was slashed by over a quarter between 2010 and 2020, while the government's £50 million injection into dentistry will fund less than 1% of the appointments we've lost since March. In fact, the BDA estimates that it would take £880 million a year to restore dental budgets back to the levels of when Labour left office. And let's be clear, these issues will hit the poorest in our society the hardest. For many, the fees for private dental treatment are simply unaffordable, and as one desperate constituent put it to me, I can't afford private treatment, so what on earth am I supposed to do? This harm will cause terrifying delays for children, for adults, for the poorest among those in County Durham, and I'm sure across the whole country. And we know that children in the deprived areas are already 3 times more likely to have hospital extractions, while oral cancer, which kills more people than car accidents in the UK, is significantly more likely to affect those in our poorest communities. Dentists are frequently the first to spot health problems. Without access to regular appointments, our least well-off constituents will continue to be more likely to develop serious health problems than the wealthiest in society. So, can I take this opportunity to remind the Minister that it's their job to reduce health inequalities, not widen them. And as elected representatives, we are responsible for protecting and improving access to key public services for our constituents. It's time the government stopped treating dentistry as an afterthought and urgently takes action to widen NHS dentistry, because for my constituents in Durham, this crisis in healthcare is very much at the forefront of their minds. Thank you, Madam.